will get vaccinated or be replaced. That's what New York Governor Kathy Hochul says after announcing that New York might recruit medical workers from other countries and replace unvaccinated staff at hospitals and nursing homes. The governor issuing this statement saying, quote, "The plan includes preparing to sign an executive order, if necessary, to declare a state of emergency that seeks to increase workforce supply and allow qualified healthcare professionals licensed in other states or countries, recent graduates, retired, and formerly practicing healthcare professionals to practice in New York State." Joining us now to discuss, New York State Republican Committee Chairman Nick Langworthy. Thank you, Chairman, for coming on today and taking the time.
Thank you.
Good to see you in person. Talk to me about, again, this order from the governor and maybe the concerns that some New York residents have about the requirements that she's putting in place for healthcare workers.
Well, it really looks like we've come a long way from having a parade in the Canyon of Heroes honoring our frontline medical workers. I mean, now you have Kathy Hochul, who's proving to be just as big a bully as Andrew Cuomo ever was by forcing a vaccine mandate, that may very well be unconstitutional, down the throats of medical workers on the front lines. We have a nursing shortage to begin with in the state of New York and across the country. And for Kathy Hochul to suggest that we bring in people from foreign countries or even force the National Guard to fill in the cracks caused by her mandate. State workers are allowing a test out exemption from the mandate. Yet medical workers, even private medical workers, are being forced into this mandate. I think it's completely unfair. I believe it's completely unconstitutional, and she really should be ashamed of herself. She's putting New Yorkers' health at risk, and this system could very well crash if we had any other surges because of a lack of employees.
You're saying, of course, she'd be putting the health at risk because there weren't enough workers to assist those who would need medical care. I did want to push back and just ask you, from these healthcare worker perspectives, is there a reason why they have chosen not to get vaccinated? Have they shared that with you? Is it personal?
As we talk to a lot of people, there are personal concerns. There are religious exemptions that are in question, but then there's also many that also have natural antibodies.
Are those covered?
And those are not covered. And there is no testing opt-out like there would be for several other elements. State employees, including the governor's own staff, they could have a weekly test out, and the governor is putting a large testing program together for all state employees. Yet medical workers are excluded from that process. So we believe it's over the top. We believe it's infringing on a lot of people's rights. And there's not a practical application where people can have other solutions and still keep people just as safe.
So again, those with medical exemptions or religious exemptions, they fall into the category of must be vaccinated if you want to work in
There
these
could
settings.
be as many as 15% of our healthcare workers in the state of New York that are not currently vaccinated in the program. Now, I believe in vaccines. I'm vaccinated. My family's vaccinated. This isn't about whether you think the vaccine is right or wrong. This is about personal choice, but also having additional solutions. There are people that can't take the vaccine for one reason or another. Maybe their health care provider doesn't think that it's right for them. This is being forced from the governor, like she's a dictator in this state. And there's a lot of people that their entire career is going to be derailed by this singular executive order.
What happens to benefits, maybe, when you're working? Have we heard from the governor in regards to what could happen with insurance if they were to be dismissed because they don't get vaccinated?
It sounds to me that they're completely terminated. So they would probably have a severance window, but that's about it. So there's a lot of people that are going to have to look at career changes or, again, moving out of New York, which is something that all too many people have done already.
Okay, let's switch gears. Talk to you about what's happening in New York City, where the City Council potentially introducing a bill to give non-citizens the ability to vote in local elections. Talk to me about this and why it sounds like you've got some concerns.
We are trying to draw a lot of awareness to this. You have, a majority of members of the City Council that are embracing, this bill that would allow non-citizens to vote in local elections. There could be as many as 900,000 to 1 million undocumented residents of the city of New York that are here because of the sanctuary city status. Federal immigration rules do not apply here for some reason because we think it's this, with the sanctuary status. But we have to stand up against this because it's about our election security. We have no voter ID in this state. It's actually illegal for a poll worker to ask you for your identification, yet we're going to have people that are completely, outside of the system of our citizenship rights to vote and choose our elected leaders. It's absolutely wrong. It's unconstitutional. It's unconscionable.
Well, interestingly enough, if you wanted to dine indoors in New York City, you'd need not only your vaccine proof, but also your identification to prove that it was you who has that vaccine card. Nick Langworthy, thank you very much for joining us and talking about these topics. We appreciate it. For you.